Hi, my name's Sarah Boyd, and today I'm going to talk about using case studies as a teaching method. So here's a bit of an outline of some of the topics I'm going to go through. What is a case study? Why is it used? The best ways to create one, and I will provide some examples at the end. So a case study is a hypothetical or actual patient situation which students study to arrive at a possible treatment diagnosis or plan of care. Case studies are often a popular as well as effective teaching and learning strategy used in nursing. Each study presents information, and then the student can decide on possible explanations for their findings and appropriate plans of care for their patient. Case studies represent an in-depth analysis of real-life situations as a way to illustrate class content. They are very useful teaching strategies to apply clinical information to real-life situations, which students can demonstrate knowledge and course content through the application of problem solving and decision making, which is very important in nursing. As I mentioned, students can form a plan of care and then find one that best meets the needs of the patient and the situation. It promotes skills for analyzing, organizing, and prioritizing data. Students can participate more in classroom discussions when case studies are used, or it's one way of promoting class discussion, I should say. And case studies facilitate synthesis of content knowledge and the ability to manage problematic situations by providing a specific example that remains in the learner's memory, and the learner can then recall on the information later when needed, like in real clinical situations. So why use a case study at all to teach? They are useful due to the limited clinical exposure that students receive. They provide a safe environment for students to learn, and they allow students to think through decisions without the pressure or anxiety that that clinical situation can promote. They also promote and enhance critical thinking, which is very important in nursing and very important for students to develop in the nursing program. I will talk a little bit more about critical thinking in a couple more slides though. Case studies provide safe and effective care, which nurses must have the ability to think independently and assess problems, determine possible situations, exercise professional judgment, and make effective use of available resources. Nurses who have critical thinking skills are able to interpret data, analyze clinical problems, evaluate evidence, make inferences, draw conclusions, and then implement effective interventions onto our patients. So critical thinking. Case studies help students to develop the skills that they need to analyze, organize, and prioritize data, as well as case studies help students to develop and enhance problem solving, critical thinking, and decision making. They are an effective way of connecting the critical thinking, problem solving, and decision making that certain students are trying to make the connections when they are in school without having to practice on actual patients, and they can do this in a safe environment. Development of these skills is essential to function as an effective registered nurse. Using case studies as an approach facilitates further development of the use of critical thinking by defining problems through discussion of relevant data and issues. They can also verify the facts so that they can make decisions. In a clinical environment, nurses need to have critical thinking for appropriate decision making and practice. They need it to provide safe and effective care, and they must have the ability to do it independently and to assess problems, to determine possible solutions, exercise professional judgment, and make effective use of available resources. A nurse who has critical thinking skills is able to interpret, analyze clinical problems, evaluate evidence, and draw conclusions, and implement effective interventions onto their patients. That's why it is so important for nursing students to develop critical thinking, and case studies are an excellent form of helping students to enhance and develop their critical thinking. Some advantages to using case studies as a teaching method above other teaching methods, or also you can use them with other teaching methods as well. It stimulates metacognitive knowledge, retention, and recall. It relates to practical applications with the theoretical. Problem solving can be practiced in a safe environment, as I mentioned earlier, especially because there is limited clinical time. It seems that students don't get as much exposure as nursing students once did to patients, so they may not get to practice as many of their skills or think of the theories and everything that they should be using in clinical as much as students used to. Cases can be used to meet many learning outcomes of a clinical course, such as if the goal is to guide the students to interpreting data, then the questions might ask students to identify important information in the situation and explain what it means. Cases can link knowledge presented in class, online, or through readings to practical situations. So case studies are very versatile. They can be presented in a variety of ways, as well as students can work on them in a variety of ways as well. More advantages to using case studies are that it promotes adult learning. As you can see, peer interaction is important for adult learning. It supports autonomy because adults typically prefer a sense of self-control and self-direction often in their learning, and they like choice in their learning environment, so working on case studies can help to promote that. They're practical, they have a purpose, which are all things that are usually very important to adult learners. They also provide the big picture, which is also very important in nursing, because as a patient, we need to look at the patient as a whole, and so many things come in when dealing with patients. So the big picture is always one thing that's very important to look at in nursing. There are some disadvantages with nursing, or with case studies in nursing. They are most effective when complex situations are used. So they might be too challenging for some students, or for early on in the nursing program. Sometimes it can be time consuming to develop some of the case studies for faculty. It's very important to have appropriate questions for case studies. Otherwise, the learners aren't meeting their needs or what they need to know and understand from the case studies. There is a lot of preparation required often for the students for the case studies, especially if the students are going to be working on them in class and in class discussion. They usually have to be up on their readings and prepared for the week. And it also does not accommodate all learning styles. But I think it's hard to find a method that does accommodate all learning styles, so this can support many learners. So I believe that is an effective method. So I've created some points to creating an effective case study to use for teaching methods. Case studies should be well structured with two components, the case and the questions for the students to answer regarding the case. The case is when the problem is described clearly with adequate information. It guides the decisions of the students on how to intervene. There's usually, but not always, one direction for the answers that relate to the current class content. The questions to answer are the second part of the case study. The problem needs to be readily apparent. If the case is ill-structured, then different problems may be possible, which may be the point of the case study later on in the course content, or for an exam, or when the students are nearing the end of the program, to be more challenging for them. There may also be, if there's incomplete data for the students to interpret, then it is difficult for them to understand, and they will not learn anything from the case study. So the problems need to be clear. There needs to be sufficient information provided, such as the background information about the patient family, the patient history, complete assessment data, if that's part of it, so that there can be a comprehensive description of the patient or the clinical situation. Cases should provide enough data without directing the student thinking, meanwhile guiding them on where to go with the answers. And the questions are key to effective use of case studies. They should be geared to the outcomes. For the outcomes to be met, questions should be included that focus on underlying thought processes used to arrive at an answer rather than just the answer alone. A couple more points about using case studies. They should be used in a safe, open, non-threatening learning environment, as all learning environments should be. At the conclusion of the assignment, you can provide a summary of the most important points for more in-depth study for the students for the future. In the beginning, teachers can use cases that present problems that are relatively easy, and so that students can learn the process of using case studies. And as they progress through the curriculum, cases can become more difficult with varied problems and different approaches, as I mentioned before, or to use in exams. So when is it good to use case studies when teaching? Well, they can be used in interprofessional groups. They can be used in peer groups, using them in clinical groups, or just in groups in classroom. It gives students different ideas, different points of view. They can explore different perspectives for the cases. And as I mentioned earlier, it's also, one of the points of adult learning is to work in groups. They can discuss possible approaches and work through it together as a team. They are also very effectively used independently, online, in class, and in clinical settings to apply theory or classwork into clinical. So I've created an example of a case study that it is a fairly simple example. So this would be something to use, for second-year students or at the beginning of a clinical group, just to refresh with your students. So yeah, you're a graduate nurse working on a cardiac ward when your new admission rings to inform you that she's having chest pain. She's a 50-year-old female, diagnosis of chest pain with no prior cardiac history. So the questions I created are, what are your priorities? Really wanting the students to start to pull the whole picture together and start to think in clinical decision making and using critical thinking about what they would do with their patients. Again, as I said, this is a fairly simple case study, so I would think that this is sort of a refresher for students that they could work through at the beginning of the year. And here I just chose to use this slide to incorporate, some visual aid into the case study, which is usually very effective for students using video or pictures. And I'd just like to mention that there are a couple other forms of case studies. One is the unfolding case study, and the other is the case method. The unfolding case study is usually a more extensive case study that progresses or unfolds over time. They can offer real-life clinical situations, as the case study does, but usually in real-life clinical situations, a patient progresses and you find more information over time as the patient progresses or as things are happening. So this allows students to build on previous knowledge and connect a little bit more of that theory into practice as things progress with the patient. They're typically longer and provide more background data about the patient, family history, and other a more complete picture for students so that they can analyze the case study in greater depth. And students are usually required to make a more detailed analysis as well for the case studies. And the case method is usually a shorter case that develops, again, around an actual or hypothetical patient, followed by open-ended questions to encourage students thinking about the cases. Usually shorter to avoid directing students' thinking. And just to refresh a couple points, some of the important points about case studies. They can vary in complexity, so they can be easy or challenging for students, as well as easy or challenging for instructors to create. They help to enhance critical thinking, clinical decision making, and problem solving, which are all critical components for registered nurses. They can be used in a variety of ways, as well as a variety of places, whether they're used individually or with groups, in class or in clinical. And here are my references for you, and thank you for listening to my presentation. I hope you have a great day.